Hi, it's Emily from the patient perspective, and today I want to talk to you about some great items to send and not to send to someone who is going through inpatient chemo. So if you're looking to put together a care package for someone you love, this is a great video on some suggestions from someone who's been there. I've actually done many inpatient stints with my cancer. I am a leukemia warrior since October of 2016. When I was initially diagnosed and went through treatment, I was actually in isolation treatment for around 7 weeks. I then spent another month at having a bone marrow transplant, and then I am now day 33 as this video recording for relapse leukemia treatment on a trial. So I've received lots of care packages and would love to help you create the perfect care package for someone you love going through inpatient chemo. So let's get started. If someone is in an inpatient chemo situation, chances are they are not allowed to have fresh flowers or a potted plant in their room, which means that if it's delivered, it would be delivered to the floor and often ends up living at the receptionist's desk and never will make it to the person that you love. It has to do with the fact that many chemo treatments are designed to drop all of our blood counts in hopes of knocking out those cancer cells. What it also means is that in addition to knocking out those cancer cells, it knocks out our immune system. And with a drop in the immune system, your body's not able to fight off the funguses and the bacteria that could come in on fresh flowers and plants. So unfortunately, those are off the list. What's a suggestion you could do instead? How about Mylar balloons? They last a long time. They brighten up a room just as beautifully, and they could possibly be arranged through the gift shops that are right downstairs in the hospital themselves, so they make an easy option. And so it's something to be considered instead of flowers. Now let's move on to making your own care package and things that you might want to include when you are creating a package for someone who is a chemo patient. This is something that you may not have thought about, but most, if not all of the items that you include should be scent free. Now that's something that may come as a surprise to you, but most chemo patients I know are dealing with at least a certain amount of nausea, and it's appreciated if the items are scent-free. So this would include things like your hand lotions, your lip balms, anything aromatherapy that you think you might enjoy and would be relaxing could actually also really upset tummies for somebody who is dealing with nausea from their medicines. So mild and bland should be your guide. Fun things to include in your package would be a well thought out card with a special note. I know I absolutely love receiving cards, and I hang all of mine up to just inspire me daily as I walk about my room. It's also really nice if you have a picture of you and the people that you love, or the chemo patient, that if you have a picture of the two of you together, that's fantastic. You might consider including some hard candies. Sometimes treatments don't leave a great taste in your mouth, and something like lemon heads or another hard candy that they can suck on during treatment is really helpful. I'll give you a heads up that sometimes the treatments that we have can lead to something called chemo brain, which you may have heard of but not really understand, and it's a fogginess that makes it hard to concentrate. So instead of choosing things that would be like novels or books, I would suggest instead magazines. They tend to be a little more easy to read because they don't involve a lot of concentration. And even if the chemo patient that you love is not in a position to really read at all, because I've been there, it's nice for a caregiver to be able to pick that up as they visit and take care of the patient in their room. As I've mentioned before, common inclusions would be something like a lip balm or a hand lotion. Again, low to no scent. And fun fuzzy socks are always something that are fun to receive. If hair loss is expected and you know your patient style, it's nice to include a soft, cozy cap. I didn't lose my hair so far on this treatment cycle, but in past treatment cycles, I have lost hair while in the hospital, and it just is kind of a cozy way to tell that chemo patient that you love them. And you want something that's pretty fuss-free and easy to slip off and on. You might choose something that's cozy like a flannel cap or a fleece cap, to something that would be lighter weight and would be considered a good sleep cap so that they could wear it easily overnight without being too warm. If you do decide to include something wearable or something they're going to cuddle with, and I'm thinking now of like hats or shirts or blankets, you need to make sure that it is durable and washable. Chemo patients tend to have sweats and they get sweaty. They might get sick on something, and they have very little tolerance for the germs around them. And so the nurses and caregivers are going to be washing their belongings every couple of days. So you need to make sure it's a material that can be washed and dried and is durable so that it can be something that they can enjoy. I would avoid sending things like pillows for that very reason and stick to things like blankets and hats and comfortable shirts so that they can enjoy them and know that they can be very easily cleaned. Okay, so now let's talk about food gifts, because as a chemo patient, this tends to get tricky. But for the people who love us, oftentimes it's their language of love. So if you want to gift someone food, I'll caution you to ask them what they're craving, because most chemo patients aren't craving anything. So one of the ways that you can fuss this out is just to ask, what are you eating best right now? Now, I'll caution you that for chemo patients, that can change daily. And it may be that someone is just surviving on things that's boring and routine as Ensures and mashed potatoes, and they don't really want to tell you that, and it's kind of boring and really not giftable. So what can you do for a food gift? One way you can offer food is to offer to feed their family. Sometimes chemo patients aren't even local to their family, and the family may be struggling to make that happen on a daily basis. So if you're friends with the family and you're local to them, consider asking them, hey, can I bring you dinner next Tuesday night? And then if you're even in a position of leadership or you're a close friend and something like this hasn't been established, there are plenty of websites that can help organize other families and friends who are local to the chemo patient's family, including mealtrain.com and takeameal.com. That would be a way to help organize very easily and for free families that would want to participate in feeding the members of the chemo patient's family who are at home. This was done for me on past admissions, and I can't tell you how helpful it was for my husband who works full-time and has our school-age daughter at home. So what we would do is we actually created the meal train, and on a month-by-month basis, we would release dates after my husband and I had kind of looked at the month ahead and figured out when he'd be in town, when they needed a meal, and when they'd be visiting me. And then we would just release those dates once a month, and family and friends that were local to us would fill up the calendar, and we knew that that was taken care of, and it was a weight off of my husband's shoulders, and a total expression of love in honor of me being in the hospital that we all appreciated. Another way of helping to feed somebody without providing a meal to their family or at home, maybe you're not local to them, or maybe you want to include this just in your care package, is to consider gift cards. I can tell you that they're always appreciated, and some suggestions would be a restaurant nearby that delivers, and that's very easy to find now that you can just Google. So take that on yourself to take 5 minutes and find some place that's local to the hospital and nearby. I can guarantee you that most hospitals have restaurants near them because they bring in so many people that have to be fed. If you don't want to do a restaurant, maybe consider a local or nearby grocery store, especially if someone's going to be long-term inpatient like we are. You can also just include a Visa or a MasterCard gift card because those have such versatility and will be very much appreciated for any number of little items that tend to come up when you are admitted especially for long-term inpatient care. Overall, just know that when someone's in the hospital, they love to receive mail and they usually love to receive a care package. So anything that you can do to let a person that is isolated in the hospital know that you're thinking of them and you love them and you send them all the good vibes you have, I can promise that your time that you've spent putting together a care package will be greatly appreciated. That's my patient perspective, and I hope you found it helpful. See you again soon.